There's a lot of people entering the room right now, so I'm going slower. Okay. Good morning, everybody, and welcome to Community Cares and Project Echo. Thank you so much for joining today's session, and we hope that the information shared today will help you serve your community better. I have a few announcements before we begin the presentation. Also, just throughout the presentation, please keep your microphones muted. Any questions that you have, enter them in the chat box. We're saving the last 10 minutes or so to do a Q&A, so we'll go over all your questions. And we are recording today's webinar. We are also offering CHES credit today. The instructions for that will come at the end, but I know when you registered, you had to put in your ID. At the end of the presentation, there's a Qualtrics form that you'll have to fill out as well. But more information on that at the end. So this is just a quick disclaimer that the information contained in this presentation is not substitute for medical consultation, and a physician should always be consulted for any health problem or medical condition. So today's agenda, we're going to do a Project Echo series overview, introductions, the actual didactic presentation, a case study, and then we'll do questions and answers at the end. So a little bit about Project Echo. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The Echo model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And for more information on Project Echo, you can go to echo.unm.edu. So, our didactic speaker is Monica J. Gills. Monica is a seasoned respiratory therapist with over 25 years of experience across neonatal to geriatric care. She earned her MAS in 2006 and became a tobacco treatment specialist in 2013 through Rutgers University. Monica launched the first outpatient tobacco cessation program at her former organization and has since educated both the public and health professionals on lung cancer prevention and tobacco cessation. Her career includes extensive work with veterans, transplant recipients, and the community outreach through Rutgers Cancer Institute. Monica is deeply committed to helping individuals live healthier lives through education, support, and compassion. Her mission is to educate and empower others, especially young people, to make healthy choices for life.
Thank
And then
you.
Oh, I'm gonna do Layla is our case study speaker. And Layla was born and raised in Puerto Rico before relocating to Jersey City, New Jersey. And after getting her bachelor's degree in nursing, she began following her passion for closing the gaps in the healthcare system. She realized that was plaguing her communities. As a lesbian and a Latina, Layla dedicated her life to working in underserved and uninsured communities around New Jersey by working with the local organizations that service mostly people who identify as BIPOC, BIPOC. She started her career as a registered nurse and worked her way through the nonprofit world where she began working with folks living with HIV and AIDS. She also worked at a LGBTQ plus clinic working with trans and non-binary folks exclusively. It was during this work that Layla discovered she wanted to do more to ensure that affirming healthcare is a reality for her. She is very excited to join the Garden State Equity team and can't wait to hit the ground running. And I'm so happy that she's here today to do the case study for Rutgers. And now I'm going to be passing it to Monica. And I have the pre-test after Monica, so I'll launch that. Or maybe Evelyn, if you could do that. Thank you.
Sure. Thank you, Sarah. Thank you for that great introduction. So today we're talking about smoking and tobacco use in the LGBTQ plus community in honor of World No Tobacco Day that is every May 31st. We have the pre-test questions. So please take your time and look at the questions here that we have for you, and we'll go over the answers at the end.
We'll just give it about another minute. Give people time to do the test. I like to get a nice cohort percentage.
Great.
So just need a few more people to participate. Almost there.
And we'll answer this throughout the presentation. We'll be able to get these answers.
Okay, I think we're on hold here, so let's end. Okay, all yours.
Okay. So the objectives that I'd like to discuss today, we're going to identify LGBTQ health disparities, describe how discriminatory practices affect this community's health disparities, discuss how healthcare practices contribute towards the LGBT health disparities, identify federal and accreditation initiatives that address LGBT health disparities, identify research challenges and the importance of LGBTQ plus advocacy. Something I'd like to share with individuals, as Sarah explained, my background as a clinician, I am a registered respiratory therapist. I have seen firsthand what tobacco does to individuals' health. And most people were not aware of this. Tobacco has been established to definitely causing 12 different kinds of cancers. Even if you don't see a cancer here that maybe has plagued yourself or your family or patients or clients, it doesn't mean that there is not some type of tobacco interference. One thing I must say, we have made great strides in educating the community and giving like the opportunities for people to become tobacco free with tabling, community outreach and engagement, and a lot of initiatives. So the smoking rate overall has come down, but unfortunately, we still have a group of individuals where the smoking rate has not gone down. And if you look here, we have individuals with low education, males, young adults. When you look at parts of the country, South and Midwestern states, we know tobacco is grown in some of the South and Midwestern states. We have the LGBTQ plus community, lesbian, gays, and bisexuals, individuals who live below the poverty line, disabled individuals, and definitely certain races and ethnicities. What most people are not aware of is that the LGBTQ plus, they face so many different social issues. They have definitely had a historical presence, and we can look this up, of discrimination, violence, and oppression. When we look at bullying, housing, they've been denied certain employment, healthcare deficiencies. A lot of providers do not have enough knowledge about how to treat the LGBTQ plus communities, especially when they're transitioning to a different gender. Then we look at business-related benefits and insurance. It doesn't even include this group. There's a lack of supportive services for LGBT elders and teens. What we look at mainly is challenges in maintaining continuous care. We have a study, a CAP study from 2022. It shows that more than 1 in 3 LGBTQ plus adults reported postponing or avoiding medical care in the past year due to cost issues. So when I mentioned transitional care, we have including more than half of transgender or non-binary respondents. We don't understand why there aren't more initiatives to train individuals that are in healthcare to understand the unique needs of the LGBTQ plus communities. So we feel like with education and different initiatives, hopefully this is something that will be standard care. When we look at this whole analysis that shows you, you have so many people that have postponed care, which will definitely increase costs throughout the United States as they're trying to get care. The more you allow a disease process to proliferate, the harder it is to treat. When we look at healthcare coverage disparities, Americans that self-identify as lesbians, gay, bisexual, transgender, or something other than heterosexual, you see here, it shows you that Unfortunately, it's in the United States, 28% of the LGBTQ plus adults of color have no health insurance coverage compared to 8% of all adults. Just think of COVID-19 when nearly a lot of facilities were shut down and people had delayed mammograms, people delayed prostate, colon care. Imagine being part of the LGBTQ plus community. In 2023, we know 7.2% of the US population identifies as LGBTQ plus. We had made a lot of great options for surveys and for filling out data, which was shortened to SOGI, which was Sexual Orientation and Gender Identity Data Collection, which helped organizations and facilities really get an idea of how many of these individuals they treat every day and to make better decisions to have staffing, education, and just the bandwidth to be able to serve these populations. As you can see here, these are some of the questions that help people to identify that population of individuals they were working with. You may see someone that present as male physically, but they may tell you their current identity is female or transgender, etc. So this helped people make better decisions when dealing and helping this population. We know that the LGBTQ plus community are more likely to be enrolled in public health insurance, which gives them a better range and better access to care because the cost may be better controlled. And it increased the impact of Medicaid policies and programs on health and healthcare experience. So we just want to make sure that people understand the importance of this data collection, which I understand is not being collected at many agencies as we currently speak. Next. So this was an audit study that was conducted, the LGBTQ plus community, somewhere on their website. You'll see that 84.8% they know their information is somewhere on a website they have visited. However, only 4.3% of the quit sites for tobacco treatment, only 4.3% mention the LGBTQ plus community on their landing page. Just figure the moment you go to a website, you want to see what that website is about to see if you want to continue further. But you have to dig into the website before you see anything that addresses the LGBTQ plus community, which unfortunately you may miss an opportunity to help that individual because they don't think they're represented. The results suggest that the quit site explicitly mentioned the provision of services for LGBTQ plus individuals on their landing page, which has a potential to engage the LGBTQ plus individuals. The whole goal is to make sure they feel seen and that they believe that this is where they can get treatment. What we want to point out to a lot of people that mean well, but just don't understand how you need to see yourself when getting care. So heteronormativity, when you think of a waiting room at a doctor's office to keep you occupied while you wait your turn, you can pick up a magazine to maybe see a subject that you may be interested in. But if you are of the LGBTQ plus community, there isn't many things there that speak out to you because our society goes towards the heterosexual more than any other group. So you look at a Cosmo cover, they're talking about, 10 things he never wants to hear you say, how to make sure, you address your boyfriend. Then you have an American super couple, power couple, and then you have this masculine power, I guess, alpha male in The Rock, Dwayne Johnson. As you're flipping through magazines, you don't see anything. There is a need for diverse representation in medical waiting rooms. So many healthcare professionals don't even think of something this simple to say, well, how do we cater to this particular group? And one thing that I want to point out is that stress is very real. And stress, we know throughout the country, we know there's certain demographics that are more prone to stress, which will increase their use of tobacco. And this is a minority stress model, which also includes the LGBTQ plus community. And from this model, we see that they have higher rates of substance use and tobacco use to help deal with stress. They are more prone to mental disorders. We know when you use tobacco, it does change the DNA of your brain, the brain chemistry, and many people that fall under the minority stress model experience health inequities. They are constantly dealing with stigma, harassment, and discrimination because of the lifestyle they choose to practice openly. And it's most people, when you think of a minority stress model, you're thinking of people of color, different people with different languages that come from different country, immigrant group. But the LGBTQ plus community can be in all those groups on top of their sexual orientation. And we need to really be mindful of the stress that they are facing every single day. The research shows with bisexual and tobacco use that bisexual women are more likely to use tobacco, even compared within the other LGBTQ plus individual groups. I'm not sure why that is, but just based on the data and the research, bisexual women, we really want to make sure that they have tobacco treatment services at their disposal. And one thing for sure, the tobacco companies that are responsible for producing these products and having them at our disposal, they definitely have predatory tactics to keep the group that we're mainly concerned about, the LGBTQ plus community, want to keep them engaged. They support LGBTQ plus organizations. They provide money. They back gay marriage as a congressperson or a representative in Congress. They will make sure that they provide money to those states and municipalities to get funding. They contribute to research, which back in the AIDS crisis days, they provided a lot of research. But we know with an HIV status, if you're smoking, you're only making that status worse. I want to go over some outreach strategies that we have to be aware of. We want to make extra contact attempts when your clients or patients may be of the LGBTQ plus community, and you want to just make sure that this is something you're aware of when you're doing your full assessment, that you know their status, and that's part of the questions that you ask, so you may know how to treat that person. I'd like to share a video where a gay woman, a lesbian woman, is talking about her experience. And I think, Sarah, you may have to unmute.
I did it again. I forgot to unmute. Sorry.
That I could not talk to
I'm going to go to the beginning.
anybody about.
This is just to give you an example
At any
firsthand.
time,
Here, let me tell you.
Yeah, this is Angie, firsthand experience.
it was fun growing up in Cincinnati, but I felt like there was this huge dark space within me that I could not talk to anybody about. And any time that I had any kind of feelings about being lesbian, I just smoked. Menthol cigarettes became my best friend. When you inhaled it, it was cool. And then when you blew it out, it was cool. I used cigarettes to cover up who I really truly was. It made me angry that something had that much power over me that left to my own devices, I couldn't quit. Cigarettes meant so many different things to me. So I had to go through the process of letting that go and dealing with the feelings that I've been hiding for the past 40 years. I did not come out until my 40s. I started unraveling all of that, resentment, anger, all this stuff had to kind of just get out. And I'm feeling good about myself as a result of quitting smoking. There was a change that took place. I looked in the mirror one day and I could see who I was. It's like I've come into myself, and Angie is a really cool chick. And I didn't know that for a very long time. I did not know that.
Just if you could see, I know we have to get through the presentation. The CDC website is being modified to comply with President Trump's executive orders. So this is something that I had in my arsenal already. So some of these videos may not be available if you were to go look for them, but this is just for us that treat tobacco users, and especially with the LGBTQ plus community. She used tobacco to dull the feelings that she had. Just be aware of the power nicotine has over individuals. So I had mentioned briefly when it came to HIV and the tobacco companies gave money for research while they knew when you have HIV, cardiovascular disease, and tobacco use, smoking increases risk for opportunistic infections. And this is something we know with HIV before we had all these great medications to keep the virus load low and undetectable. So even though they provided money, they still wanted you to use their products to cope with the stress and discrimination and bullying and ostracization of having an LGBTQ plus identity. And of course, cardiovascular disease is worsened with tobacco use. And there are resources here, and I just want to show you what other places are doing, not just the United States. Canada, our neighbor to the north, they have resources. It was something called Take the Last Drag, which is kind of like a good play on words. People in LGBTQ plus communities, some are into drag culture, but they're letting you know, listen, take the last drag. You do not need tobacco to cope with your everyday life as dealing with an LGBTQ plus lifestyle. You can be smoke-free and still be fabulous. And of course, lung cancer is something we know that 80 to 90% of lung cancers are attributed directly to tobacco use. Lung cancer is the most frequently diagnosed cancer among gender minority patients. And unfortunately, when we look at the heterosexual population, when it comes to receiving lung cancer screening and low dose CTs, we know about 17.2% of the individuals that are heterosexual, they do get screened from. Unfortunately, when we look at the LGBTQ plus community, it's only 2.3% of these individuals that did receive a screening, which unfortunately does not give us an opportunity to catch a lung cancer at stage 1 and stage 2, and these individuals are being diagnosed much later on. So this is missed opportunity to provide health care that can change lives for the better. And I want to share this other video that the government in 2016 was part of the tobacco fight for the LGBTQ plus community. So please listen to this. I love this video.
I'm known for my cute face and flawless skin. I'm known to be a queen with a sensible male hair. Known for that. My smile. I'll be known for a lot of things, but I will never be known for wrinkled skin, yellow nails, smelly hair, or a busted smile caused by what? Smoking. Yes, queen. Every cigarette is doing you damage because I'm known for my flawless. I live free from tobacco.
So this is what happens when the government can be involved for the good, right? You get with the different local municipalities, Congress people, representatives reach out to Congress and say, look, we have an issue. But this was from 2016. As I said, this was in my arsenal. I don't know if you could even find this anymore, but the campaign with the tagline was freedom to be tobacco free. So what a more powerful message to say you can be fabulous, fierce without tobacco. So there are other ways to cope with tobacco. I mean, there's other ways to cope without having to use tobacco. And we talked about this with the specific smoking interventions with the last drag, which is in Canada, something I wish we could replicate here. I think these are okay. Barriers to screening, we talked about that. There are gaps in cancer screening, knowledge, and emotional, financial distress. So we know, again, what we're talking about when it comes to screening is catching these cancers early so they can be treated so people can have long, productive lives. And one also I like to share with individuals that are thinking of transitioning, when you are going under gender affirming care, tobacco will interfere with wound healing with estrogen and testosterone. So if you are a trans male, that will now need testosterone to help you appear and feel more of the gender that you feel. You are using tobacco, it will interfere with the 7,000 chemicals, will not allow your treatments to be as successful. So I want to make sure people understand, when you are going through this life-altering change, please understand what tobacco use can do. And I'm big on advocacy. Yes, we are talking about World No Tobacco Day, which is celebrated and recognized every May 31st, but there are many different days. The VA for veterans has something called the Great American Spit Out for chewing tobacco. That's every February 20th. We have something called No Menthol Sundays, so you don't smoke on Sundays. In November, we have the Great American Smoke Out. And I did talk about the Spit Out Day. And then there's something called Take Down Tobacco. So if you're working with a client and they're trying to find a day to quit, oh, well, I missed the Great American Smoke Out, I've provided you with other opportunities to be able to advocate for, listen, this is a great quit day idea. These are the references, and then I would like to turn it over to Layla Orlando, who will be doing a case study. Thank you for joining us and listening.
Hi, everyone. Okay, give me 2 seconds and I will share my screen. Can everyone hear me okay?
Yeah, we can hear you.
Okay, awesome. All right, so 2 seconds, y'all. I don't know why this isn't letting me share. Okay. Can you all see my screen?
Yes.
Okay, awesome. All right. So hi, everyone. Monica, thank you so much for doing such an incredible job. My name is Layla Orlando, like Sarah mentioned earlier. My pronouns are she, her, hers, and I'm the Director of Health Equity and Wellness here at Garden State Equality. So just want to talk to you all about a case study that we had. So every month we run our tobacco support groups or tobacco focus groups, and we just like to talk to community members about some of the reasons that they might be smoking or some of the reasons that prevent them from quitting. And we found someone who has said it was okay for me to share her information. So Justine is a 36-year-old transgender woman who identifies as a lesbian, who comes to our focus groups and our support groups, and identified herself as someone who had been smoking for a really, really long time. She was an active smoker when she first joined our support group 2 years ago, and now she is no longer. I tried to get her to come join us today, but unfortunately she couldn't. But 2 years later, she is no longer a smoker. So some of the things that I wanted to highlight were that she began smoking at 16 just due to peer pressure, stress, and wanting to fit in. Peer pressure and teenagers go hand in hand, especially when you're an LGBTQ teenager growing up in the world. You try to find a space where you can fit in, whether that is with the band people, with the cheerleaders, with people who are smoking, just to make yourself seem, like have a community. So smoking ended up becoming a habit for her throughout college and then into adulthood. Like I said, when she first joined our support group, she was still an active smoker and was smoking about a pack a day for over 12 years. So thinking about all of the health risks that come with that. And then she did have a family history of cancer, which increased her risk already of potentially being at risk for other cancers. And these are things that we talked about while we were in support groups. So again, kind of some of the information that Monica has already shared. So in terms of what changed, one of the biggest things that Monica talked about was finding a provider who provides LGBTQ care. So I put a little graphic because we do have, as a part of Garden State Equality, our affirming healthcare map. So you can go on our map and find providers all throughout the state who can help you either quit smoking. It's a primary care doctor, cardiologist, podiatrist, kind of everything and anything that you can think about health related, you can find on our map. So all of our providers have been trained by us or another LGBTQ plus organization. And that's actually how Justine found one of our quit centers utilizing our map. And she was able to then go to the quit center, get support, and then ended up quitting smoking. So one of the things that led to her going to the doctor to begin with was that she started feeling shortness of breath. She would come to support group and be like, I'm exhausted from just going up and down the stairs. I feel like I'm just fatigued all day. And then once she got to the doctor, she was a little hesitant. So we actually sent her with a buddy, which I think is awesome that we can do. And she found a provider who saw her as not only a person, but also an LGBTQ person, and kind of found all of the things that other doctors may have missed just because of her sexual orientation. Like Monica said, Monica didn't say she's trans, but Monica did mention that trans and non-binary individuals who are either on testosterone, estrogen, or any type of hormone replacement therapy are at risk for wounds not healing. So when Justine found out that, hey, people who smoke oftentimes don't have great wound healing. She said that she's clumsy and she hurts herself all the time. So there were a lot of factors that led her to go to the doctor, which again was really beneficial for her. But again, so she felt symptoms and she was like, you know what, I need to go. And she ended up going. When they did a CT scans, they did do a CT of her lungs because she had mentioned that she had been a really active smoker for 12 years. And they said, hey, we can see some damage on your lungs. We're not sure what that's attributed to, but we can see some damage in your lungs. And that was all that she needed to be like, you know what, y'all, I'm going to quit. So one of the things that she did, and I have a little graphic here, was she set a quit date. She came to support group one day and was like, hey, y'all, by Equality at Work, which is an event that we have here at Garden State Equality, by Equality at Work, I'm going to quit smoking. And we were like, okay, do you think that's realistic? How can we help support you? What is it that we can do? And she said joining the safe space, like the support group that we were a part of, really helped. Nicotine replacement therapy, so gums, other patches really helped her too. And one of the things that we found is mints. A lot of folks who engage in smoking or who utilize substances, they need like some type of I don't know the right word for it, like something to, like a fidget almost, something like it's like an oral fixation that you need. So mints were a really big thing. So whenever we had support group, we always made sure that we had mints around because we were like, okay, we know that this is going to help her on her journey. Like, why can't we do this little thing and it doesn't cost us anything? And then one of the biggest things is that she started counseling. So we were able to connect her with a mental health counselor who was able to just talk to her about some of the stresses that she was going under. So for folks who may not know, in terms of the LGBTQ community, Black and Brown, trans women, especially those of color, face the most intersections and the most discrimination throughout our system, especially our medical system. So now you're thinking, okay, this individual is a trans woman, so she's already facing discrimination. She's obviously part of the LGBTQ plus community. Okay, no problem. And she's also a Black and Brown person, which again puts her at the bottom of the list and therefore can come with discrimination, stress, emotional barriers. Monica talked about social determinants of health, like all of these things added up. So just small things like just connecting her to a counselor that was free, that could help manage some of the stress, made a really big difference in terms of what the outcome was. So some pros and cons, and I will share all of the data with you from the support group if you all want. This is just one person. But one of the things that she mentioned that was helpful was obviously the support group, friends and family. And I say chosen family because within the LGBTQ community, the family that you are born into isn't always the family that you identify with. Mental health counseling was really important, as well as healthcare providers, like I mentioned, that were competent in LGBTQ care. There's this really magical feeling when you go to your provider and you're like, hey, this is who I am. These are the things I'm on. This is how I feel. And your provider hears and listens to you and accepts you as a whole person. So that was a really big pro for Justine. And then in terms of challenges, nicotine withdrawal is real. We know that it is a lot harder than people may make it seem, especially if you've been smoking for 12, 13 years. It's hard to do something that has become so normalized and such a part of your routine. Social pressure from community members. A lot of LGBTQ people, we congregate at bars and games and all of these outings, and it's really normal for alcohol and smoking and other like substances to be around. That's been normalized within our community. So a lot of pressure came from outside of our support group, like, hey, you don't want to hang out with us at the bar this weekend? And it's like, of course I do, but I don't want to be around triggers that could potentially put me in a space I don't want to be in anymore. And then the fear of weight gain, that was a really big concern. And I didn't even know that that was something that could potentially happen, as I'm not a smoker. But the fear of weight gain and gaining all of the weight from the stress and not being able to handle things correctly was a really big concern. So then some of the things that really helped, and I'm so sorry, you all, I am in the office and we are a dog-friendly office. If you hear dogs in the background barking, I'm so sorry. So one of the things that really kept Justine going on her journey in terms of tobacco cessation was the improvements that she was seeing within her health. So she started noticing, like, hey, I'm not fatigued anymore. Hey, I can go up and down the stairs without a problem. She had better mental, y'all hear probably the dogs. She had better mental and physical health. So when she would come to support groups, she started becoming a mentor for others who were looking to quit smoking as well. And one of the things I thought was interesting was that she was saying that she financially was saving more money. She was no longer spending money on cigarettes every day or, 2 times a week or however often she was buying cigarettes. It was something that she now could save to put into a gym membership, to put into buying books about, making sure that she was doing the right thing in terms of like her mental health. So that's kind of all I have. Keep living well was my last little thing. But I will throw it back to Monica.
So does anyone have any questions over the materials we discussed, what we talked about? Please feel free to put it in the chat.
I don't see any questions in the chat yet, but if anybody has any questions, please feel free to unmute if you have any questions.
And this was just to make sure if you have clients or patients that are in the LGBTQ plus community and are using tobacco, they're not going to be able to quit as easily. So just be mindful of that with everything that they are facing. So just want to make sure everyone has good understanding.
I had a question for you both. So it is one thing to say that, like, oh, we're a safe space for the LGBTQ plus community, but how can we as healthcare professionals, public healthcare professionals, how can we make a place actually feel safe for this population?
You have to treat someone like they belong. If they feel that they belong, they will be more likely to accept care from you.
Yeah. The only thing I will add to what Monica just mentioned is when I joined and I introduced myself, I utilized my pronouns and I said my pronouns are she, her. If you can see, Evelyn has pronouns in her description as well with her name. Sorry to call you out, Evelyn. You're on my screen. But just having simple adjustments in your practices, in your clinics, really makes a big difference for folks in community. So just utilizing your pronouns lets people know, like, wow, you care about pronouns. Here are my pronouns. And that just kind of helps with building trust in like your spaces.
We have a question in the chat. With the 28% of LGBTQ people of color who are uninsured, how does that compare to uninsured rates of people of color and the LGBTQ community separately? So I think what's the difference? Like we see 28% of that population. What is it in the general population? I think is what Allison is asking.
I don't have the data on what it is in the general population because we're talking a lot of cuts have been made already. So those numbers will change. And I would say go by state to state to see what resources are still available. A lot of quit centers that treat everyone have received some deep cuts, like some quit centers throughout the country that I've met with have mentioned that they don't have enough nicotine replacement supplies. Usually they would have, if it's a 4 week or 6 week program, they would have been able to provide nicotine replacement for the full 6 weeks for each individual patient. However, they may only have 2 weeks worth of supplies due to all the cuts that have been made. So it's hard to answer that in today's numbers.
Yeah, and I was
Is
just going to mention, Allison, sorry, Evelyn. I was just going to mention that a lot of times in terms of data, LGBTQ people and BIPOC individuals, so Black, Indigenous, people of color, don't always fill out surveys in the right way. So a lot of times we'll see if people's gender identity isn't mentioned on a form, they may not fill it out. So a lot of this the statistics as well could be a little bit higher than 28%. So just some food for thought as well.
Yes.
Yeah, it was me. Hi, I'm Allison. I was, I figured that, that you might not have that specific number, but that just kind of spiked my curiosity because I was wondering, is it, being a part of the LGBTQ community that's more of a pool, or it being more of a person of color that's more of a pool? So I was just kind of interested. But thanks for your insight, though.
Yes. And I could say when we do our assessments for the state of New Jersey, we do ask, how do they identify? So we'll know if they're heterosexual or what have you, or bisexual, LGBTQ plus. So we keep that data. And I think the more data you keep, the more you understand the population that you're treating.
Does anyone else have any questions? Allison, thank you for that question. And I guess with what Monica was saying with those cuts and then compounding what Layla was just saying, that that number is going to go probably up a lot more from that 28%.
Like, I can share that I have worked with veterans extensively in a different capacity, opposed to just tobacco treatment. I've treated their lung diseases. And just one of the meetings I attended, that I was told that a support group for LGBTQ plus veterans was no longer available, that that person that was running those groups lost that position. So I don't know if we have anyone from the VA system that can speak on that or is aware of that, but I believe that's what I heard early 2025, that that group is no longer even available for support.
Here's a question. Would more awareness educational efforts need to be continued, especially about cancer rates in LGBTQ plus population?
Yes, I think so, because we see that there's a reluctance to even get screened. When we looked at the lung cancer screening rates for the heterosexual community, it's about 17.2%. And you look at the LGBTQ plus community, it was under 3% of individuals that did receive lung cancer screening. And lung cancer screening, like for instance, the case study that Layla did, that's a 36-year-old who doesn't fall into the criteria for lung cancer screening. But if you go see a primary care physician, no matter what your age is, and you're talking about symptoms, you're symptomatic with anything dealing with your lung, they can order a diagnostic CAT scan. So be mindful of that too. They don't have to be in a 50 to 80 category to necessarily get a lung CT.
Right, those are the general guidelines for smokers, but I think a lot of
For
yeah.
Medicaid coverage, Medicare coverage, but you can have, at any age, you can have a CT scan that may detect early lung cancer. So,
I'm curious about the fear of weight gain and how much that impacts because I know there is a lot of peer pressure to look good. within the community, especially with the men. So is that like a even higher than the general population, you think?
We discussed that when you're providing tobacco treatment, you talk about some of the different symptoms that can come positive. Like you may cough more, but now you're bringing up more mucus that was suppressed. And because your tongue is no longer being inundated with all those the chemicals coating your tongue, your appetite may increase. So we tell most smokers gain between 5 and 8 pounds, regardless of gender. And we tell them to make better food choices. When you have an increased appetite, people usually go for crunchy, sweet, and salty. So you warn them in advance. Your appetite will increase, but let's make better food choices.
On that note too, Layla, for your client patient, what did you do with her concern? Like what did you recommend for her concern of gaining weight?
So one of the things that we did was, like I said, we tried to have as much support within the support group. So one of the things that she had mentioned in terms of like fear of gaining weight was just like snacks and availability of like healthy food. So we made sure that like all of our support groups had like a healthier option. We helped her, we set her up with a nutritionist to kind of like talk about some of the choices that she was making just in terms of food. So we did try to help as much as possible. There's obviously a lot of things that we can't do, but we did try to point her in the right direction and give her the resources that she needed to help. Like I said, she mentioned one of the things that she did with her money was join a gym, and like that kind of helped with like the fear of weight gain, because she was like, I'm not spending, $40 a week on cigarettes, that now I'm spending $40 a month on a gym membership. And we do have a buddy system. So we all joined the gym, and we did go with her so that she was never alone either. We wanted to make sure that she knew that she had support within our group and even outside of our group as well.
Layla, can you talk a little bit more about the buddy system? I heard you mention it before when you were doing the
Yeah.
case study, you mentioned it again, and it sounds very interesting.
Yeah, so we have a buddy system here, even with our interns, with our staff members here. Some folks may not necessarily feel safe walking around community. We've had a lot of our trans and non-binary folks who work here, who are like my staff members, my employees, just walking around the street, and people will like throw slurs at them, and it makes it an unsafe environment for them to just walk around the neighborhood. So the buddy system is whenever we have support group in person, if people want to go get lunch, if people just want to take a walk around the block because they're triggered and they're like really stressed out, there's always multiple people who go together. So the same thing when it comes to the gym. Sometimes we have people at different stages during their transition. So somebody might be fully transitioned, socially, medically, with their friends, where somebody else is just starting their journey. So they become buddies and they kind of help each other and are like, hey, these are things that I've done that have helped me, get to the place I'm at now. Here are some of the doctors that I go to because they are LGBTQ competent doctors and they just make me feel safe. So the same thing for the gym. They're like, hey, you want to start going to the gym? You're like newly transitioning. Like, let's make this something that's safe for you and like not something that you're fearful of doing. So
That's really great. I have a few more slides. Thank you for all of the questions. If you have any more, feel free to ask them in our Mighty Networks. That is the platform we use to post everything, so you'll see that. Okay, from current slide.
We have one last question real quick.
Yeah.
Is the use preference higher for tobacco versus vaping, or is it the same? That's a great question.
It depends on the age of the individual. We have younger people who are predominantly vapors, and we have an older population that's using traditional combustible tobacco. So it depends on the age, I would say.
That was a great question. I have the post test that we can do real quick.
Okay, so number one, smokers are 15 to 30 times more likely to develop lung cancer compared to people who have never smoked. Number two, smokeless tobacco products such as chewing tobacco and snuff contain at least 28 chemicals that are known to increase the risk of cancer. Tobacco companies have historically utilized targeting marketing strategies to specifically increase tobacco use and brand loyalty within the LGBTQ plus communities. Yes, true or false? I think we did answer all these questions, right? I think so.
I
Do
think
not
so.
worry.
And we're almost there. We have about 50%
Great.
participation. So if we could just get that up to 75, then we can close the poll and we can get the answers. So just people can finish up the poll. We would appreciate it. Just a few more. Hear more, please. Nope, I think we're static here. So I'm going to go ahead. Oh, I'm going to go ahead and end the poll and we can share the results.
That's great.
Here are the answers to the poll. They're all true.
Yeah, all the answers were true.
We get 100% on question number 2. Good job, people.
Just a few more slides to wrap everything up. In New Jersey, we have NJ Seed, and they provide free screenings. They do breast, cervical, colorectal, and prostate, and the link and the phone number will be in the chat for that. And thank you so much for attending today's session. Please use the link to let us know how we did. And if you are getting CHES credit or want CHES credit, you need to fill out the QR code by Thursday, June 4th. So that's 2 weeks from now. I will be following up with everybody today, tomorrow, sending an email with the link, the PDF of the slides, and any other resources that Monica and Layla would like to share. But yes, please fill out the form. There is a spot for you to put your CHES number if you are getting the CHES credit. Mighty Networks is our platform where we upload all of our recordings, our PDFs, and resources. And then later this month, next week, we have a survivorship session on the impact of primary care physicians on survivorship. So please join us then too. And thank you so much. Thanks so much for joining us today. And thank you to our incredible speakers.
And
Thank you, everyone.
May I end with this? If you know anyone who's smoking or vaping, hey, just say to them, World No Tobacco Day is May 31st. And if you could quit for just that one day, you might be able to quit longer.
Thank you all. Sarah, somebody mentioned if they could get the registration link for the next session.
Yes.